Stomach aches, gas, heartburn, and other digestive symptoms may be unpleasant, but they are typically not causing concern. However, these signs may also be a sign of a more severe health problem. Hey, everyone! Welcome to Daily Positive Dose. In today's video, we are going to go over 12 common digestive disorders. Do talk to your doctor if you are experiencing any of these common digestive disorder. So without further ado, let's get into it. Number 1. Gastroesophageal reflux disease, GERD. If you are experiencing heartburn or acid reflux more than a few days per week, you might have gastroesophageal reflux disease or GERD. The esophagus transports swallowed food to the stomach. The lower esophageal sphincter, LES, is a ring of muscles that connects the stomach and esophagus. When the LES is weakened, stomach acid will leak back up into the esophagus, causing heartburn. While acid reflux and heartburn are normal, having symptoms that interfere with your everyday life or occur at least twice a week may be a sign of GERD. Over time, this can do irreversible harm to your esophagus. Furthermore, GERD affects about 20% of Americans. Changes in lifestyle, such as consuming smaller meals and improving what and when you eat, will help manage GERD. Antacids and prescription-strength acid blockers can also be beneficial. Number 2. Peptic ulcer disease, PUD, and gastritis. PUD is an open sore in the stomach lining or upper portion of the small intestine. It affects over 15 million Americans. Gastritis is a condition in which the stomach lining becomes inflamed. These two conditions share symptoms such as stomach pain and nausea, as well as related causes. The most common cause of PUD is a bacterial infection called H. pylori, which also causes chronic gastritis. Another common cause is the use of nonsteroidal anti-inflammatory drugs, NSAIDs, such as aspirin, ibuprofen, and naproxen. Antacids and proton pump inhibitors are often beneficial. Number 3. Stomach flu. Stomach flu, most commonly known as gastroenteritis, is a general term for a variety of inflammatory issues in the gastrointestinal tract, with the most common symptoms and signs being diarrhea, nausea, vomiting, and stomach pains. In the United States, fewer than 2% of the estimated 100 million people who experience stomach flu symptoms per year need hospitalization, but in developing countries, it is a leading cause of death, mostly due to dehydration. So you must drink water and electrolyte drinks to avoid dehydration. Number 4. Gluten sensitivity and celiac disease. Gluten sensitivity and celiac disease symptoms are identical. Diarrhea, bloating, and stomach pain are among them. Gluten sensitivity is relatively common, affecting about 5% of the population in the United States. True celiac disease affects less than 1% of the population. It is important to see a doctor for a proper diagnosis. Do not attempt to self-diagnose. Celiac syndrome, as opposed to gluten sensitivity, is an inflammatory disease that can cause damage to the small intestine. Gluten, a protein found in wheat, rye, barley, and oats, is the primary treatment for both conditions. Number 5. Inflammatory bowel disease, IBD. Inflammatory bowel disease, IBD, is a chronic inflammation of the digestive tract. The two most common forms of inflammatory bowel disease are Crohn's disease and ulcerative colitis. IBD, which includes Crohn's disease and ulcerative colitis, affects about 1.5 million Americans. They are autoimmune disorders, which means that the immune system reacts abnormally. IBD causes inflammation and swelling, which causes diarrhea, stomach pain, lack of appetite, fever, and weight loss. Crohn's disease mostly affects the small intestine and the beginning of the colon, while ulcerative colitis affects the colon and rectum. IBD can be treated with drugs that inhibit the immune response. Surgery is sometimes required. Number 6. Irritable bowel syndrome, IBS. People sometimes mix up IBS and IBD. IBS is described as abdominal pain that occurs at least 3 times a month for at least 3 months in a row. You may also experience constipation or diarrhea. IBS, as opposed to IBD, does not affect the digestive tract and is much more common. IBS affects more than 15 million Americans. The precise cause of IBS is unknown. Eating smaller meals and avoiding foods that cause symptoms can be part of the treatment. To treat IBS, some people use laxatives, fiber supplements, or probiotics. Number 7. Constipation. When bowel movements become less regular and stools become difficult to pass, this is referred to as constipation. Constipation is likely if you have bowel movements less than 3 days a week. In the United States, about 63 million people suffer from chronic constipation. It usually occurs as a result of a shift in diet or routine, and not having enough fiber in your diet is a common cause of constipation. Most of the time, increasing fiber, fluids, and exercise will cure this disease. Laxatives can only be used as a temporary solution. Number 8. Hemorrhoids. Hemorrhoids are swollen blood vessels in the anal canal that cause pain. Pressure, itching, and bright red blood following a bowel movement are all symptoms. Constipation and pregnancy are two of the most common causes. Hemorrhoids are widespread, affecting 75% of people over the age of 45. Adding fiber and plenty of fluids to your diet will help you prevent constipation. To alleviate discomfort and itchiness, use hemorrhoid cream, suppositories, or warm water. It may feel awkward to discuss hemorrhoids, but don't let that deter you from pursuing treatment if your hemorrhoids persist. Number 9. Diverticular disease. Diverticular disease includes diverticulosis, small pouches that develop in the wall of your colon, and diverticulitis, inflamed diverticulitis. This disorder affects about half of people aged 60 to 80. You might experience bloating, constipation, or pain in your lower abdomen. Changing your diet is normally part of the treatment. Consult your doctor right away if you are experiencing rectum bleeding. To treat diverticulitis, you may require antibiotics, a liquid diet, or even surgery. Number 10. Gallstones. Gallstones are hard deposits that grow in your gallbladder, which is a thin, pear-shaped sac that stores and secretes bile for digestion. Gallstones can develop when your bile contains too much cholesterol or waste. Gallstones affect approximately 20 million Americans, but not all of them are severe. Some gallstones are asymptomatic and disappear on their own, while others can cause intense pain or infection. They can cause sharp pain in your upper right abdomen as they block the ducts leading from your gallbladder to your intestines. Medication may often dissolve gallstones, but if it doesn't work, surgery is required to remove the gallbladder. Number 11. Lactose intolerance. Lactose intolerance is a digestive condition characterized by an inability to digest lactose, the primary carbohydrate found in dairy products. Lactose intolerance is caused by insufficient production of the enzyme lactase, which is needed for lactose digestion. Lactose intolerance may cause a variety of symptoms such as bloating, diarrhea, and abdominal cramps. Furthermore, lactose intolerance affects between 30 and 50 million Americans. Primary lactose intolerance is caused by a decline in lactase production with age, resulting in poor lactose absorption. People with lactose intolerance may need to reduce or exclude dairy products from their diets, possibly losing out on some nutrients. Number 12. Anal fissure. Anal fissures are tiny tears that form at the anus. When attempting to move big or hard stools, these tears occur. Anal fissures may cause discomfort during bowel movements, bloody stools, or a noticeable crack around the anus, as well as a skin tag or lump around the fissure. Anal fissures are commonly caused by straining and rough bowel movements, as well as constipation. However, they can also be caused by diarrhea or soft stools. A high-fiber diet that produces well-formed, bulky stools is often the most effective treatment for anal fissures. With that being said, here we come to the end of our video. I hope you liked this video. If so, then, don't forget to subscribe to the channel, so you never miss any video. See you in the next video. Till then, take care. Thanks for watching.